you get a glimpse of making order out of chaos sometimes, you know what I mean?
Yes,
It's almost Genesis-like here, man. Because you had things that were just really, I mean, you had extra teeth, you had no room for teeth, you had some silver caps on some baby teeth that had not done what we wanted them to do. We got rid of some supernumerary or extra teeth that you had. Even though on the lower the crowning was very pessimistic, we're trying to get things in a proper position so that one day you can orthognathic surgically have the bones put in the right place, okay? So we did the lower non-extraction, and we got it all in and line, and we got to a point where we were waiting on this cuspid. And the beautiful thing about this cuspid is we were able to position the teeth in such a way that that cuspid, which was way up here, that's that tooth in that picture, it was able to navigate its way in. And as that tooth erupts in, it brings some bone with it, which in a cleft site, that's gold, you know what I mean? Bone on you is gold. So now we have it in, and we have everything prepared. Your 6-year molars are functional, your 12-year molars are functional. You have wisdom teeth for which you have no room, and they're going to need to go away at some point, but let's don't focus on that right now. We have everything positioned, looking good, in preparation of you one day finishing growing so that we have a non-moving target and they can surgically put the bones in the right place, all right? But all these teeth that we have moved around, I mean, you look back at this guy and the way those teeth were just in the trauma there. We have all that made normal now.
Golly.
But all these teeth that we have moved to their new places, as we move them to their new places, the gum tissue around there just got kind of stretched and distorted. Now that the braces are off, that elastin tissue would like to pull things back where it belongs. And we want things to stay put exactly as they are this moment. So we're making retainers. You'll have one for the top, one for the bottom, and the retainers embrace every tooth and hold them perfectly positioned. And over time, those gum fibers remodel and relax in the new place. If you wear the retainers, the teeth cannot move. If you don't wear the retainers, the teeth are going to move. There's not the possibility that they will move. There's the promise that they will move if you don't wear the retainers. So the retainers are a very important part to our long-term success here. So we count on you being awesome with them. The retainers need to be worn every night. Now, by wearing them just at nights, that removes the risk of you having to carry them to school, which is a common place for people to lose them, throw them away, whatever. So we take that risk off the table, but that puts tremendous emphasis on you being consistent and wearing them every night. Every night includes weekends. It includes stay over at your buddy's house. It includes family trips out of town. There are 0 nights off. And we need approximately 12 hours every night. So if you just slide them in at bedtime and sleep 6 or 8 hours, that will not be sufficient. As soon as you get home from school and ball practice, 4, 5, 6, 7 o'clock, whatever time it is, you immediately get your retainers in. Supper time rolls around, you take them out, eat, brush, put them back in. Wear them while you're doing your homework, watch TV, sleep in them. You're a clever boy. You'll figure out how to get 12 hours.
Mm-hmm.
How many hours?
12.
How many nights?
Every day.
Every night. Good answers. Our first appointment back is going to be in 3 months. Every time you come see me, bring your retainers with you. I always want to see them in, see how they're fitting, see how they're holding up. It's called a retainer check appointment. I want to check your retainers. Somebody will come today for a retainer check appointment without their retainers. Don't be that guy, okay? Between appointments, if you ever lose them, break them, anything happens to them, we would like to see you to replace them immediately. This is not something that you can lose and go, maybe they'll miraculously show up, so you wait a month before you mention the mud. Oh yeah, I lost my retainers, and because by then something has drifted somewhere and it's crooked and nobody's happy. Okay, so if you go in on a Tuesday afternoon and you can't find them, you immediately let your folks know, and they'll get you here. All right,
Sir.
Do you have any questions about anything I've done to you? No questions.
No, sir.
You happy?
Yes, sir.
You happy?
I'm tickled.
Good. He's got.
I never thought that we'd really see this. And looking at that picture and seeing how
Come a
young
long
he
way,
was,
hasn't he? Oh, my
look at that
word.
little guy.
He's come a long way. These radiographs are just fun to follow.
That one right there.
Even right here, from there to there, just
Yeah,
as we
look
were
at that.
starting to straighten those front teeth, he still had the supernumeraries and all we had to go get, but that was just kind of from there to there, kind of making some order out of things. But you worked very hard, Jonathan. You got a nice change, and we just got to wait now for you to quit growing so we can consider a surgery. The other thing, we're making 2 mouth guards for you today. We're making a clear one. You said basketball,
Mm-hmm.
and then a colored one for football, because football makes you the ref has to see a colored one. So you're getting 2 mouth guards. It's important. You protect yourself.
Yes, sir.
You know, I know wearing the clear mouth guard for basketball is probably, not the coolest thing, but if you watch the NBA players, all of them are chewing on mouth guards, okay?
Yes, sir.
So you're not crazy. This was a very nice change. You need to hug your folks and thank them for doing this for you.
Yes, sir. And thank you.
Thank you. And then demonstrate to them how much you appreciate it by wearing the retainers and keeping everything proper. That's all they ask, okay?
Yes, sir.
He's been a great kid. Thanks for letting us care for your man.
Mm-mm.
He's been a treat.
I tell you what, 17 years ago, I didn't know what we were going to do.
Sorry, baby. I know.
And now look
I
at him.
know.
Look at my 17-year-old. Almost 18.
He's a handsome kid.
He is.
He's a good boy, too. That's,
He really
that's the
is.
most important thing.
That really is.
I can imagine how frightened you were.
We were scared to death.
I know. It's just, you're scared enough just being a parent.
That's exactly right.
And then having a challenge delivered to you, you're just, it's overwhelming. But y'all muscle through it, man. Y'all
It's a long time.
Y'all got him on track. And it's a nice change, and we just got to let this boy finish doing his DNA and grow on up, and then we'll put everything in the right place. But the repairs and all that have been done so far, like I said, he's a good-looking kid.
Well, I'll tell you what, if you look, I think even at that picture, his nose was even better in that picture. But Dr. Moses talked about how the nose grows all the time.
Yes, ma'am.
And it's funny because you can really tell as he's growing that, it needs a little tuck or whatever it is they do. But they're not worried about it yet. They said, let's just wait and do. They like to do everything at one time. So.
Yeah. Nose and ears, they keep growing all our life. That's why
That's
I got this
right.
big old honker on my face right now, okay?
Do you realize this started when he was 6 days old? You were 6 days old was the first time you saw Dr. Moses. And your first surgery was when you were 14 days old. That's been a long time. The first 20 weeks of his life, we spent 17 weeks back and forth to New Orleans. We went once a week for 17 weeks.
That's what great parents do. That's what great parents do.
Thank you.
That's your one purpose in life, take care of these children. Now, just
That's
about
the
it.
truth. That's the truth.
You won't. There's no greater calling. No greater calling. Well, let's go get our appointments made.
Sounds good?
They're working on the retainers. They'll be ready in just a few minutes. Do not leave till I see them in. We can go get everything crossed and dotted so as soon as you get them ready to scoot. Okay?